Hello, everyone, and thank you for joining the NeedyMeds special topic webinar, Counterfeit Drugs in America, 2017 Overview. My name is Carla, and I am the Education Coordinator here at NeedyMeds. And before we get started with today's presentation, I'm going to go over a few housekeeping tips. Feel free to type any questions you may have into the questions section of your GoToWebinar control panel. But keep in mind, we will reserve answering questions until the end of the webinar. If we do not have time to answer all the questions or your particular question, please know we will follow up with you personally via email. This webinar is also being recorded, and it will be available for viewing on the NeedyMeds YouTube channel as soon as we convert it into a video, which usually takes just about a couple of days. So let's get started. For those of you who don't know about NeedyMeds, we are a national nonprofit organization. And here is a shot of our current homepage. I just put that up on a slide because our website is really the face of our organization. Anyway, the NeedyMeds mission is to educate and empower those seeking affordable health care. And we define education really in two ways. One, by educating people about NeedyMeds and the resources we offer. And two, by letting them know about other invaluable resources and timely healthcare topics, which is why we are so pleased to have our guest here with us today. It is my pleasure to introduce our panelist. Shabbir Safdar is the Executive Director of the Partnership for Safe Medicines. And that organization, the Partnership for Safe Medicines, is actually a partner of NeedyMeds. When I asked Shabbir for a quick bio about himself, this is what he mentioned. He said, please let everybody know that my most favorite and least favorite thing about my job is researching and publishing stories of Americans personally injured by counterfeit medicines and devices. Shabbir is passionate about finding ways to help Americans save money safely. So without further ado, I'm going to go ahead and pass the mic and the screen to today's host. And you will hear just a moment of silence while we do that. Thanks, everybody, for your patience. And Shabbir, take it away.
Thank you very much. Let me just make sure I put up a screen that does not have my email and the presentation.
Perfect.
All right. So good morning, everyone. I am the Executive Director of the Partnership for Safe Medicines. I have been working for PSM for almost a decade. My time as Executive Director just began this year, so I did my time in the mailroom, as they say. Today, I'm going to go over a couple of things, but let me first introduce you to who PSM is. People always want to know, well, who is your organization? Everyone wants to know who's a part of it. So this is our membership. Our membership is pretty much everybody that touches healthcare, patient groups, doctors, nurses, people who make drugs, both the generic and the research branded drugs, people who move the medication and devices from factories into doctors' offices and pharmacies, and then the pharmacies themselves, as well as a number of groups that represent pharmacists and folks that work on healthcare policy. So it's a really broad array of folks. They all pay dues that help pay my salary, and I am grateful for their one thing that they agree on, which is that counterfeit drugs are a problem in America today and how to deal with that. So I'm going to cover an overview of the counterfeit problem in America. I'm going to talk about some myths and facts about importing drugs, because that comes up every year in Congress and in people's proposals, and talk about really what the story is behind those ideas. And then the most important thing is I want to talk about how you can save money on medication in such ways that you don't endanger your safety. And that is often the most important and one of my favorite parts of the talk, because people think, oh, I'll just import drugs from Canada, I'll buy them from a website. And what they've done there is they've sacrificed their safety without necessarily saving a great deal of money. And so we'll talk about how, both for yourself and for the people that you work with, how you can help them save money without endangering themselves. So let's start out with the idea that counterfeit medicines are not a big problem in America. This is a raid. It was in 2014. It is not an unusual raid. Investigators who work overseas tell me that this is very typical of counterfeit medication. All those boxes are full of packets, blister packs with wonderfully, perfectly looking printing of counterfeit medication. I actually just ordered some about a month ago for some lab testing we're going to do. I cannot tell the fake medication from the real medication. I'm working in this industry, so this is really a big problem, and we don't hear much about it in America because we have probably the best and strongest supply chain of the world. And in fact, other people come to America when they're getting their medications if they have any concern that they're getting the real thing. But there is a world full of people who are manufacturing the fakes because it's an infinite profit margin when you're putting nothing in your pills. Unfortunately, these fake medications have made it to pretty much every state in the country. When the FDA's law enforcement arm finds smugglers smuggling counterfeit medication into America, they seize all their computers and their mail, and when they do that, they look through it to see who they've been doing business with, and they send warning letters to all those people, usually doctors' offices and medical clinics, to let them know that they've been doing business with somebody who was caught with counterfeit drugs. And so those letters are public, and we track them. And last year we crossed a sad figure that every state has had a warning. So there have been people in every state in America doing business with arrested, or at least with arrested counterfeiters. Now, counterfeit drugs often have things in them that are cheaper than the actual medication, but are not particularly good for you. In the worst case, the counterfeits have things that are downright poisonous, heavy metals, for example. There was a woman in Vancouver who took some diet pills that were laced with heavy metals and died of the heavy metals. They'll use road paint and other kinds of paints to get a certain color so the pills match the look of what a real one is, or they'll use various kinds of fillers like brick dust just to give them some bulk. We have seen active ingredients that were pulled from the market because they have negative health effects added because the FDA, can only withdraw these things from the market in America, but overseas people still make them and put them into medications like sibutramine. And then the worst case, it's hard to tell what's the worst case. Is it the worst case when they poison you with like mercury in a fake drug, or is the worst case when they actually make a fake cancer drug and you die of cancer? It's hard to tell which of those is more evil, but one of them is certainly undetectable. The biggest story in 2017 in America and in Canada, unfortunately, is this ingredient called fentanyl. There was just yesterday in Ohio an officer who did a traffic stop, and the person he was stopping, he suspected of being in the drug business, and there was loose fentanyl in the car, and it got on his shirt. And then while talking to some other officers and the EMTs who were there, he touched the dust on his shirt and it absorbed through his skin and he immediately overdosed. If you look at this photo, the New Hampshire State Police Crime Lab did it to show what a fatal dose of heroin looks like in terms of quantity, and then fentanyl. And what's happening is that counterfeiters and drug dealers are both dabbling in using fentanyl, because if you just put 1 or 2 grains into a pill, it does have a narcotic effect, but it's not really a good ingredient because you can't control exactly the distribution of the grains. And so over and over again, we're seeing around America people ODing on fake drugs made with fentanyl. Sometimes they're pain pills. Prince was actually found, his body was found with a bottle of counterfeit hydrocodone pills made with fentanyl. And as you can see, it doesn't take much to overdose. And so whoever manufactured those and sold them to whoever gave them Prince just didn't do a very good job or didn't care. But we're also seeing people who are putting them into things that you don't typically associate with overdoses or with abuse, like Xanax. It takes a lot of Xanax to really hurt yourself. And people who are addicts tend not to be taking Xanax. We've got a gentleman in Santa Cruz who passed away a couple of years ago who took a Xanax because he was having trouble sleeping. And he got the Xanax from an unsafe source. It was not from a pharmacy, and it turned out to have fentanyl in it, and it turned out to have a fatal amount of fentanyl in it. And he was not looking to get high. He just wanted to try and sleep. He was having trouble sleeping. So this is happening all over America and in Canada. In Canada, there is a particular community where, the teenagers have experimenting with drugs. One of them took a Xanax that they got from a friend who probably got it from a drug dealer, and this poor 15-year-old girl who really didn't have a history of any kind of drug abuse just took one and dropped dead pretty much on the spot. And it's very, very tragic that you can take a single pill and that can end your life, especially when that pill is not considered to be an easily abusable pill, and yet there we go. We have people dropping dead from it. It's really awful. The ease with which the fentanyl crisis has reached America is due to the fact that it's very, very easy to get a pill press to make your own pills. And so we're seeing all over America people making their own pills. They're importing fentanyl, and then they're actually pressing their own pills. And so it's become standard practice now that when police raid a drug lab, they often go in full hazmat because they're not sure if there's going to be an open container of fentanyl or fentanyl around the building where they are. And as you know, as I explained, just a few grains can overdose you right away. This is actually a very nice pill press, by the way. The pill presses that you can find on eBay, they can be found for a little less than $200. They ship from China, of course. Another thing that we're seeing in America that is quite dangerous is counterfeit cosmetic injectables, both fake Botox and fake fillers, as they call it. I guess people inject fillers into different parts of their body to make them look fuller and more pneumatic. But the problem with these fakes is that they often don't have medical grade products in them. There have been cases of people actually with hardware store Home Depot grade silicone and getting it put into a filler, and those things will leak into your lungs, and you'll literally your lungs will stop being able to function. It's like having sand poured into your lungs. And so this is a X-ray of a woman who died after she got a cosmetic injectable that polluted her lungs. This is a huge outbreak. Almost every state in the country has had people, nurses or cosmetic physicians and clinics who've done business with these counterfeiters who import this stuff from unknown sources. And it's super dangerous. Botox has a lot of uses besides cosmetic. People also use it for migraine headaches. I have friends who do that. And TMJ, it's got over 800 therapeutic uses. And so the fact that this is becoming a counterfeit, popular counterfeit, is very, very disturbing. Something that started about 4 or 5 years ago that is particularly horrific is we are seeing people buy black market IUDs, and these are actually typically OBGYNs who go on the internet and buy an IUD, which is an implanted birth control device. It's intrauterine device is what IUD stands for, and they are buying them on the black market, so they don't know where they came from or if they're sterile, and they're inserting them into patients. The particular danger of this is that a patient, she generally trusts her OBGYN not to put something in her body that has not come from a sterile and licensed manufacturer. And so most of us, even me, when I'm getting a shot at the hospital, I don't demand to see, at least I didn't used to demand to see the bottle that they took the injectable from for like a vaccine, for like a Hep B vaccine or something. And so you don't actually get to see the product before it's put in you. And then the female patients, if they're having side effects, can't examine the product because it's implanted in them. And to get it out, they can't take it out themselves. They have to go back to the OBGYN to get it removed. And in some cases, in one case, I should say, there was a doctor, an OBGYN, who was buying black market IUDs, and his patient had side effects, and she asked him to take it out and give her a different one. And he took out the same one and put it back in. And that patient actually ended up losing her uterus as a consequence of this medical incident. So it's really, really dangerous to insert things that come from unknown places into your body, and we're starting to see it happen in America as of 4 or 5 years ago. The worst and probably most high-profile counterfeit case that we've seen in the last 10 years has been the market for black market oncology drugs. It's all over the country. A Canadian, people talk about these Canadian pharmacies. Well, one of these Canadian pharmacies that is one of the biggest decided to get into oncology drugs because they said, well, they're expensive and we can make a lot of money. And so they set up a whole sales network, a whole sales team in America, and they were sourcing them from unknown places overseas and selling them. And because they were looking for the cheapest priced, they ended up with fake oncology drugs. And this is particularly heinous. Betty Hunter died of her cancer, and she had an aggressive cancer that really did need real medication. There was no room for error in her treatment protocol, and she died of her cancer, and we only know that she got a counterfeit drug because her doctor, unrelated to her, was raided by the FDA's law enforcement arm, and they seized their medication and tested it and found that it contained just mold and water. Usually when you take a counterfeit cancer drug, if you die, people say you died of cancer. There's no evidence that they just injected saline into you instead of actual cancer medication. There's no proof that that fake medication may have had some impact, and yet there are hundreds and hundreds of doctors around this country who've done business with these wholesalers who got caught red-handed with counterfeits. Betty Hunter's sons now do speak to the public about the danger of this, and it's very, very scary. If you are going through cancer treatment, I suggest you talk to your physician about how they source their medications. It's very, very serious. So here's let's talk a little bit about the concept of drug importation. It's very popular, comes up about every year. There's always someone in the healthcare debate who talks about how it's the answer to healthcare costs. And one of the myths is that when you go to a website and you order medication, that you're getting drugs from the Canadian drug supply. People always say, well, if it's good enough for Canadians, it's good enough for us. The problem is, if you go to a Canadian website that says it's a pharmacy and you order medication, that pharmacist is either not a Canadian pharmacist or not in Canada, because it's not legal for a Canadian pharmacist to dispense medication to an American without a Canadian doctor's prescription. What happens is that some Canadian pharmacists moonlight and have a whole separate inventory, because if they are dispensing to Americans not from Canadian drug supply, it doesn't actually count as being illegal. And so you'll get medication they bought on the black market, the same places that people are buying these counterfeits with fentanyl and these black market oncology drugs. And you're not getting Canadian drugs. That's the key. If you go and stand in a pharmacy in Canada, you'll get the same drugs a Canadian does. But if you go online, you are definitely not getting the same drugs that Canadians do. And Health Canada, their version of the FDA, does not take any responsibility for medication that is shipped to America. So they can send you whatever they want, and they're not going to get in trouble. Another thing people often say is, well, this is just a Republican issue or a Democrat issue. So we looked, because the federal government, the White House agency arm of the three powers, has the ability to do some importation, and every single FDA commissioner and Health and Human Services Secretary for the last 15 years, appointed both by Democrats and Republicans, have all said that this is not safe. They've refused to certify the safety, which is a key step in any plan to do this. And a number of them are on very clear record that they don't think it can be made safe, no matter how much money you throw at it. And so that's a really important issue. When there's bipartisan opposition to something, then generally it's probably a bad idea. We actually do order medication from time to time for lab testing from Canadian pharmacies. I just recently ordered one. I should have taken a picture of it for you. I went to the website and ordered it. I promptly found out that the website was in for the former Czech Republic. And when I ordered my medication and I got the tracking number for the package started out in India and came to me. And this was a Canadian pharmacy. It was certified by a fake Canadian pharmacy certification board that says that they check them for safety. There is nothing Canadian about this operation at all. Sometimes if you actually get a package from Canada, what they've done is they've shipped it to a warehouse which sits outside of customs and then shipped it from there into America. So it looks like it came from Canada. They'll put it in a new box and everything, and it'll have address data and labels on it that actually came from Canada. But that medication never passed customs into Canada. It was never part of the Canadian drug supply. People who propose importing drugs often talk about how, well, there's going to be a criminal penalty. Nobody would actually do this with the threat just over the border of American law enforcement taking them in. Well, the executives from CanadaDrugs.com who are accused of distributing those fake cancer drugs that Betty Hunter died of are currently under indictment for their $78 million fake cancer drug operation. We know the drugs are fake. The FDA seized them out of an oncologist's office and lab tested them. And these guys have spent the last 2 years sitting in Canada continuing to run their business despite being under indictment. It's just really, really hard to arrest people in other countries for shipping poisonous medication, counterfeit medication to America. It seems like it would be an easy thing to do, but they basically operate without fear. They just can't go to Disney World, I guess, is their only real downside. They can't vacation in America. The other thing that's important is that the Canadian drug supply actually doesn't have enough drugs to supply America. One of our board members, Marv Shepard, studied this. If just 10% of Americans started ordering from Canada, we would basically empty their supply in about 9 months. And the Canadians, are terrified that we're actually going to do this. And so a broad array of patient groups in Canada have all said that we don't want Americans to order their drugs from Canada. It's really quite dangerous. If you ever actually get drugs out of the Canadian drug supply, you're going to cause shortages. And so they're not thrilled about this. We actually have on our board a gentleman named Mac McCall, who's a pharmacy professor at the University of New England Pharmacy School. And he has long said that he can't tell, and most pharmacists will tell you they can't really tell. Counterfeits are easy to make that look identical to the real thing. And so as an experiment, he actually ordered from one of these companies that actually advertised in a Portland, Maine newspaper in his hometown. And this was the company he ordered from. It had all sorts of certifications to make it look real and look like it came from Canada. And so he ordered three medications. And the first thing they did was they asked him to waive all liability in a legal document and then assigned him a Canadian doctor who never met him, who didn't have a full medical history and could have possibly issued him medications that were dangerous to his health because of side effects. And then the three medications he got all had problems. The generic version of Nexium he got only had about half of the actual medication it was supposed to have. And this is very common. The counterfeiters do this in order to fool the cheapest lab tests. If it has some ingredient, then the cheapest lab tests will say it's not a complete fake, and sometimes they'll let it through at the border if it gets caught. The generic of Celebrex actually had only about 3/4 of the active ingredient listed on the package for dosage, and the blood thinner, the Plavix generic, actually contained what we think was probably a cleaning agent, a chlorine-based cleaning agent It was probably used to clean the pill press or one of the other pieces of machinery that they use to make the drug, um, and that you should not be putting in your body as part of your healthcare regimen. So those are the dangers, and those are why, ordering from Canadian pharmacies is not a way to save money. Let's talk about the ways to save money. And NeedyMeds is a key part of our strategy when we educate patients and patient caregivers about this. The first thing to know about saving money in America is that generics are almost universally cheaper in America than Canada. And 88% of all medicine dispensed in America is dispensed as generic. So for 88% of the medicine in this country that people take every day, it is cheaper here than in Canada. And so we do these about every week or so. We do one of these price comparisons where we call a Canadian bricks and mortar pharmacy a real one, not a cheap one, not a fake one, because the fake ones will underprice everybody because they're not real medicine, but a real Canadian pharmacy that you could walk into if you went to Toronto or Montreal. And we ask them, how much does a 30-day supply of this medicine cost as generic? And then we do the same thing with an American pharmacy. And over and over and over again, we find that the medicine is not only cheaper in America, but it is cheaper even after you factor in the currency exchange of the Canadian versus the US dollar. In all of these, we are actually using US dollar prices that we've converted from the Canadian currency. And it's always cheaper. And the reason it's cheaper in America is because Health Canada actually sets price controls for generic medication. And it's not a free market up there. They actually set the price of what the generic will cost. And it's set higher. Whereas in America, anybody who has a manufacturing license from the FDA and has been inspected and is in an ongoing inspection regime is allowed to sell generic medications. So a lot of those generic medications are subject to free market competition, which lowers the price. The second thing that I would recommend you do when you're looking to save money is a tip that Consumer Reports has pioneered and that we use the goodrx.com search engine for, which is to shop around. This is a price for a generic that Consumer Reports did in Raleigh, North Carolina, and I think they called around. They didn't use GoodRx, but they found that the pricing for the same medication, the same dosage, the same number of days, a 30-day supply, was wildly different. I mean, it was 5 times different between Costco and Walgreens. And so they recommend that you actually stick with an independent pharmacist and that you specifically ask them what is the cheapest way to get it. Because some pharmacists, have contracts that say they're not allowed to recommend something, but of course they're allowed to answer direct questions. I've had pharmacists, one of the lead pharmacists in Wyoming who runs the state pharmacy association there told me that quite often it is cheaper to buy with cash instead of using their insurance. Another thing is to use medication assistance programs. You can go to the NeedyMeds website. The very first thing you should do is go to the NeedyMeds website and type the name of the drug that you or the patient you're taking care of is taking into the search engine in the top left. That is the smartest thing you can do because they will find all sorts of discounts and coupons. And it's like Coupon Central there. And the card is free. Anybody can get it. You don't need to fill out any kind of special paperwork. Also, the Partnership for Prescription Assistance helps people who are uninsured or underinsured to access medication. Sometimes it will be a free supply of that medication for 30, 60, or 90 days. And if you fit that criteria, that's very, very helpful as well. So I mentioned generics. Always ask the pharmacist if this is cheaper with cash. There's a lot of generics that are only $4 for a 30-day supply. You comparison shop with GoodRx. And just to give you a sense that this is not even just generic, if you look at insulin, and there are no good generic, I don't think there's any generic insulins at all. I think they're all under patent still. The savings you can get by shopping around or using the NeedyMeds programs is significant. And this is for 4 popular kinds of insulin. There's so many options out there. There's coupons, there's NeedyMeds, there's comparison shopping. You can get really big discounts, and this is with non-generic medication. So there's a lot of ways to save money without leaving the safe world of licensed U.S. pharmacies. If you do go online, there are actually online pharmacies in America that have state pharmacy licenses. You know, it's a warehouse in probably in Kansas or Texas or someplace where warehouse space is cheap, and you can, if you find a pharmacy that either it has a .pharmacy domain name like Walgreens.pharmacy or has the VIPS logo, they have a U.S. pharmacy license. They are safe to shop from. And there's a list of them at nabp.pharmacy, which runs the .pharmacy domain name for Americans. Something else you can do if you want to save money is to look at our website. We have a lot of educational materials, and we actually will print and send them to you for handing out in your own community. This particular one, we call it the bookmark because it's about the shape of a big bookmark, has these ways to save money on one side. On the back side, it's got some myths about Canadian pharmacy websites. And so it's a fun document to hand out, and it's a lot of information packed into a small space, so you don't have to keep up with a big 8.5 by 11 sheet or a pamphlet. That is all I have prepared for today. I would be absolutely happy to take questions now if you have some.
Fantastic. Thank you so much, Shabbir, for that informative presentation. I consider myself well acquainted with the Partnership for Safe Medicines just because, as I said in the beginning of the webinar, NeedyMeds considers you guys a partner, but I am overwhelmed. I guess I didn't realize the breadth and scope of how far this counterfeit issue really reaches. In particular, I had no idea that people can be injected with fake Botox, with fake IUDs. It's really frightening, but thank you so much for not only breaking it down, but arming everybody with really crucial information so we can continue to be engaged and smart healthcare consumers. This is really important, and one of the things I'll probably touch base with you after the webinar is we're going to, at NeedyMeds, need some of those cards that you distribute so we can make sure we distribute it to NeedyMeds users as well. In the meantime, I'm going to go ahead and remind everybody, I already see a couple of questions actually coming in, but if you do have questions, please go ahead and type them into the questions section of your GoToWebinar control panel. And as I said, if we don't get a chance to answer your questions, we'll follow up with you personally via email. But let's review a couple of questions that are already coming in. So here's the first one. Let's see if I read this correctly. I heard Senator Bernie Sanders say that all drugs are cheaper in Canada. In particular, he said that Crestor is $779 in America, but only $201 in Canada. So was Bernie wrong?
Yes, Bernie is wrong. What happens? I like Senator Sanders. I think he's a charismatic guy, and I like some of his policies. But on this particular topic, he often will talk about medicine prices in America versus Canada, and he'll talk about the branded medications price when there's a generic available. And he does that because it makes his point really well. But if you're an actual patient, you're probably going to get the generic, right? You're not going to intentionally pay more money than you have to. He does it because the numbers look really great, but the truth is, for a lot of the medications he talks about, there's a generic available, and the generic is cheaper in America. In fact, because Senator Sanders mentions Crestor a lot, we looked it up. It's one of the first ones we did a Canadian pharmacy versus U.S. pharmacy comparison for, and it was totally cheaper in America.
Wow, okay, well, thank you for clearing that up because that does sound like a big misconception and something I'd probably ask myself. So here's another question coming through. Why shouldn't we order medications from Canadian web pharmacies? Aren't they made in the same factories we get in America?
So the answer is no. When you order from a Canadian web pharmacy, it's not actually, as I mentioned before, actually Canadian. Most of them are not Canadian at all. And the ones that actually have some participation by Canadians, they're basically running a separate operation for mail order to the US than they would dispense to their own people. And so it's not made in the same factories. There are a very small number of of factories in the world that are FDA inspected facilities. There are many, many, many more that are inspected by foreign governments, governments I would not trust to protect my health, and some that aren't inspected at all. As I mentioned before, you can buy a pill press for less than $200. And so India, while a lot of our medications are made in India in inspected factories, there are many, many more garage factories around India that are doing bulk mail order of medications. And that's what you're going to get. When you go online and you look for the lowest price from someone who doesn't have a U.S. pharmacy license, they're buying medication on the black market from whoever's got it cheapest and shipping it to you. And they don't really care because they don't live in America. They're never going to get arrested or prosecuted. In fact, you may not even know that your medication wasn't working until you have a stroke or you have a high blood pressure medical incident.
Oh, it's frightening. Thank you. We do have a couple more questions coming in. A person wondering, is the absence of fear of counterfeits coming from the lack of law enforcement? Are the penalties too low? And are the penalties only financial ones?
So that's a really good question. We've studied this for a long time, and we always are wondering what will it take to make it serious. There is on the record evidence that there are drug dealers, there are drug smugglers over in Mexico and elsewhere around the world, especially the cartels, who love to traffic in counterfeits made with fentanyl and counterfeits made with counterfeits of actual medications like blood thinners, because the penalties for those are in fact lower than the penalties for smuggling heroin or cocaine. And so they're happy to do that. They know that not only are the penalties low if they get caught, they're not likely to get caught. If you smuggle heroin, there's an entire agency that is dedicated to finding you and tracking you down and bringing you to justice. And there's partner programs, where the government of Venezuela is working with the government of America and yada yada. Those don't exist in as much breadth or scope for people smuggling fake Lipitor. And for that reason, it's a lot safer to make money smuggling fake Lipitor than it is smuggling heroin. And so they do. Quite often, if you are a smuggler overseas smuggling counterfeit drugs into America and you are smart enough not to set foot in this country, you'll probably never get caught. You'll probably never do jail time. You may get indicted, but as I showed you before, even if you're the most egregious counterfeit drug smuggler and you get indicted, you can still operate your business in another country while your lawyers slowly fight extradition, which is what's happening, I think, right now in Canada. It's just not enough of a deterrent. So it's a great business to be in if you're a shady kind of person. And if you live even farther than Canada, like the former Czech republics or in Russia, you definitely have carte blanche to operate, and you're probably never going to get brought to America to justice.
That is really frightening, and as you had said, you really drove that point home with one of those PowerPoint slides of what was happening to that poor woman, Betty, who had passed away with the fake oncology meds. And as you're saying, you're really painting the picture that it's not only that the penalties are lower than they would be for other, Class A felony drugs like heroin, but the fact that even if the penalties were harsher, we still have to work on the enforcement part of it.
Yes.
Shabbir, you had mentioned also that at Partnership for Safe Medicines, you guys order and actually test some of the suspect products. And one of our audience members was wondering, do you actually have your own lab, or do you work with other pharmaceutical companies or labs to test those suspect products?
So we don't actually work with pharmaceutical companies on this because we need to make sure that we have chosen a third-party lab that has no affiliation to anyone. So we use third-party labs. It would be anyone who works in this space who tells you that they test their own drugs, who is also a healthcare policy wonk, probably doesn't do one of those two things well. It is really, really hard. It takes $5,000 and a solid week or more of time to test a medication. And when we have them tested, we have to test for a number of things, some of which I barely understand. But the first of which is is there an active ingredient in the product? And is the filler that goes to that active ingredient um, the right kind so that the medicine is available to your body? Second question is there enough active ingredient? The counterfeiters know that there's like a sub $5,000 device that just checks the molecules that are present in a substance, and if it finds any active ingredient, it will say that this is not completely counterfeit. But that doesn't mean that it's going to help you if there's not enough active ingredient. I mean, you could break a pill into quarters and test a quarter of the pill in one of these basic machines, and it will tell you it's the real thing. But taking a quarter pill, as you know, is not necessarily going to get you better. So the second thing that the labs test for is presence of sufficient quantity of active pharmaceutical ingredient. And then the third one, and this is where we get into science that I'm only barely understanding, is the crystalline structure of the chemicals set up so that it absorbs into the body well? It is possible to have the right amount of medication and the right medication in a pill, but if you screw up the molecular structure in such a way that it doesn't actually absorb properly into the body and you end up flushing out the medication. All those things have to be right in order for medicine to work, which is why there are regulated manufacturing facilities that do it. Some of them, many of them are overseas, but they're still inspected by FDA inspectors and by manufacturers who contract with them to make this medication, because this stuff is hard. And when you get into biologic drugs, it's even harder, because some of those things are grown and they are very sensitive molecules. And some of them you can't actually shake them or leave them to get warm. If you look on our website, there's stories of people who ordered biologic drugs that have to be kept cold. And they've ordered them from one of these fake pharmacies that came from India with like a lunch freezer packed in them, and the whole thing is warm. You can't treat sensitive medications like oncology drugs like that. If you let them get warm, then they turn into basically just water, and they will not cure your cancer, even though it may be the real drug when it started out its life.
That's amazing. Thank you so much for those very thorough responses to some of our audience's inquiries. It looks like we are running out of time for questions, but for those of you that we haven't had a chance for, as I said, we'll follow up with you personally via email. In the meantime, Shabbir, I'll ask you if you could switch the screen back so I can grab it, so that I can leave these folks with, thank you, there we go. Hopefully everybody, can you guys all see my screen? Shabbir, can you see my screen?
Absolutely.
Great. So what I wanted to do is, of course, thank you so much for taking time out of your schedule to join us today and to give this really informative webinar. We're going to try and rope you in to maybe repeat this webinar a little bit later in the year for a newer audience. But in the meantime, for those of you that did participate today, as I had mentioned in the beginning, this is being recorded, and we will work on turning this video, this webinar into a video, and we'll post it on our YouTube channel so that you'll be able to share it with your colleagues, family, or friends. In the meantime, I wanted to give you a snapshot of some other diagnosis-specific or health topic-related webinars coming up next month. We do at NeedyMeds try and keep our calendar as robust as possible for free webinars, so check out our calendar regularly, and you can register for any of these webinars or check out other ones coming up on the online calendar on the bottom right-hand page of the NeedyMeds homepage. The other thing is I wanted to leave you guys with some contact information for me to make sure you know where to find the Partnership for Safe Medicines. And also, if you are interested in finding other free and safe ways to get some assistance for your healthcare costs, including medications, please be sure to visit our NeedyMeds website, give us a call at the 800 number, or join one of our free monthly overview webinars. Of course, thank you for our audience for joining us, and a big, big thank you to you, Shabbir, the Executive Director of Safe Medicines, for today's really informative and timely presentation. we will all be in touch and have a wonderful and healthy rest of the week. Thanks, everybody.
Thank you.